Good morning and welcome to the program Breakfast Show. It is coming to you on Radio Nigeria Core City 99 FM. My name is Ekene Odiugwe. As the rainy season begins, across many communities, health experts are once again raising concerns about the increase in malaria cases, especially among children and pregnant women. Pools of stagnant water, poor environmental sanitation, and delayed treatment often contribute to the spread of this deadly but preventable disease. Today we are discussing malaria prevention during rainy season, practical steps families and communities can take to stay safe and healthy. Joining us in the studio is pharmacist Nonso Maduka of Bensther Development Foundation, Enugu, and a member of the Enugu State Malaria Advocacy, Communication and Social Mobilization Core Group, for joining me this day. You're welcome to the program, sir.
Thank you for having me. It is a pleasure to be here.
Many people notice that malaria cases seem to rise during the rainy season. From a public health perspective, why is this period particularly dangerous?
Yet, rainy season is a dangerous period for malaria infection. And that it's because of two reasons. Number one, the rain creates stagnant water reservoirs, and there's a lot of them. You see abandoned tires, there will be collection of water. You see abandoned cans, there will be collection of water, and at times the gutters get clogged. And you also know that during rainy seasons, when people want to dispose of refuse, there is always this tendency to throw it into the gutters, believing that the rain will carry it, but they end up blocking the gutter, and the water will be there stagnant. And now that environment is a beautiful environment for the mosquito, the female Anopheles mosquito, that is the vector for transmitting malaria parasite, to breed. So you have a high density of the mosquito during rainy season. That's number one. Number two, the rain makes the environment quite moist and increases humidity. Now, humidity is very, very good for adult mosquitoes because it helps them to live longer. And then when they live longer, it means that the parasites that they have, the plasmodium parasite, the parasite that causes the infection of malaria, has enough time to mature in the mosquitoes and then be able to be transmitted. So for this reason, rainy season is a dangerous period with regards to mosquito transmission. Thank you.
When it rains frequently, we often see blocked gutters, drainages, stagnant water around homes, around offices, and overgrown bushes. How exactly do these environmental conditions encourage the spread of malaria?
Yes, this environment encourage the spread of mosquito because you have to understand that these are the environments that enable the mosquito life to be propagated on Earth. Almost all the stages of development of the mosquito, from egg to the mosquito, happens under the water. The egg is laid underwater, the larva is developed underwater, the pupa is developed underwater, and from the pupa case, the mosquito emerges. All this happens underwater. So the water is a very good environment for increasing the density of the female Anopheles mosquito that bites people and transmits the malaria parasite. And so when there is rain and you have stagnant waters in these places, the breeding of the mosquito occurs more. So you have more mosquitoes that are available. It means you have more mosquitoes biting people. It also means that you have more likelihood of more mosquitoes transmitting the parasite to people. So yes, these environments actually increase the spread of malaria.
Sometimes people assume every fever is ordinary stress or typhoid and delayed treatment. What are the common warning signs of malaria people should never ignore?
The common symptoms of malaria usually include fever, chills, headache, vomiting, muscle aches. However, these symptoms are not unique only to malaria infection. Other fever can also present with these symptoms. So the best thing is when you have these symptoms, you go and get tested. That will confirm if you have malaria. Yet I agree at times that people tend to delay, but the danger is malaria can become a very severe infection that can lead to kidney damage, liver damage, cerebral malaria that is very, very severe. So people should stop ignoring the symptoms of fever, the symptoms of cold, chills, sweating, at times vomiting. At times you see diarrhea, muscle ache. You shouldn't ignore it. It's good that you go and get tested. Unfortunately now, the Enugu state government, under the National Malaria Elimination Program, working with ACUs, they are providing this test free at primary healthcare centers.
Let's talk prevention now. What are the simple everyday actions families can take to reduce mosquito breeding around their homes, especially during the rainy season?
Yeah, the common ways to stop mosquitoes breeding around our homes, it's number one, we're going to make sure that we don't give an opportunity for water accumulation that will turn to a stagnant water pool. And so by that, you make sure that the gutters around our homes are unclogged, made clean so that the waters can flow easily. We make sure if there are grasses growing around our homes that we'll have to cut them so that they don't give an opportunity for water collection, because the key for malaria breeding is the collection of water. And then this habit of people washing clothes and then leaving the water without even pouring it out, you make sure that that does not exist, neither in your bathroom. And then when it comes to disposal of refuge, you make sure that you dispose your refuge on time, because at times those containers that people pour in refuge, they don't dispose it on time. Rain falls, they collect there, mixing with the dirt, and it becomes a very good environment for mosquitoes to breed. So we need to make sure that we dispose our refuse on time and in the recommended places, not just inside the gutter. So if families will observe this, they by themselves would definitely reduce the breeding of mosquitoes around their homes.
If you're just joining us, this is the Breakfast Show on Radio Nigeria, Coal City 99 FM, and we're talking about malaria prevention during rainy season. Our guest is pharmacist Nonso Maduka, Bensther Development Foundation, Enugu, member, Enugu State Malaria Advocacy, Communication and Social Mobilization Core Group. Remember, you can join the conversation on coalcityfm929.net.ng. Back to you, pharmacist Nonso Maduka. In many communities, people still rely heavily on self-medication or herbal mixtures without proper diagnosis. How risky can this be in malaria treatment?
Yet self-medication is not encouraged. It's always good that you get tested to be sure that it's malaria, because most of the time, the symptoms of fever, chills might not necessarily be that you are infected with the malaria parasite. It might be other disease that is also eliciting such symptoms, and so you'll be wasting finances, you'll be wasting your time treating what is not there. Secondly, that abuse of drugs is beginning to cause anti-malaria resistance. So we are abusing the drugs, and actually in the real sense it might be that it's not malaria that is the case. So it's always good that people go and get tested. When you suspect that these symptoms could be malaria, please be sure, go and test.
Before taking malaria drugs, experts now recommend proper testing. Why is malaria testing important? And where can people access reliable testing services?
So malaria test is really, really important, because not only is it that it confirms if you have the malaria infection, but it also gives the density of the malaria parasite in your blood. Now, this too also helps the clinician to determine the dosage of the drugs he will be prescribing for you. Now, apart from that also, there are some type of malaria infections that will require not just the usual drugs, especially the malaria parasite that at times have a liver stage that is quite significant. And so it is the test that helps you to identify, okay, you are down with this particular kind of malaria parasite, for example, P. vivax, or that it is P. falciparum. And if it is P. falciparum, which is very aggressive, is left untreated, it also helps the clinician, the doctor, to know the drugs to prescribe for you. So testing is really, really important. It makes treatment very, very efficient and effective.
Beyond individual households, malaria prevention also requires community action. What role should community leaders, youth groups, schools, and local residents play in keeping neighborhoods safe?
Yes, for community leaders, schools, there are things they can do to reduce the spread of malaria. Number one is sanitation. Sanitation does not have to be once a month. It can be weekly, and where possible every 3 days. That's one. Then secondly, it's effort on educating the community members. For example, I think people don't take malaria infection seriously. They don't think that it's a serious disease, but that malaria infection can actually lead to convulsion. It can affect your eyes, it will damage your kidney, it will damage your liver, it can enter your brain. So it really affects people severely. And so when they appreciate that, then the community leaders will take lead in organizing sensitization programs, educating their community members. Schools will make it a point of duty to educate their students on how to protect themselves from mosquito bites. Yeah, and then people will also take out time to practice some seasonal chemo prevention approaches that is available to reduce the risk of getting infected, especially at risky seasons like this. So indeed, communities have a role to play. The truth is this: Nigeria contributes 31.9% of global malaria death. So malaria is a big deal in Nigeria, and it's not something just individuals should do. Communities putting their hand together can actually help a lot. You get in both spreading the information and then making sure that the environment is kept clean.
What more do you think government agencies, healthcare providers, and organizations involved in malaria advocacy should be doing during this rainy season?
Increase awareness and sensitization. That is the key. At this season, a lot has to be done to get the message out so that people can know how to protect themselves from malaria. Now, if you are sleeping, please sleep under the net. If you can, okay, why don't you use the repellent? Why don't you wear long clothes that will cover your body very well? If you can, screen your windows, screen your doors. Now, these are information that needs to be out there. Now, more interestingly is the fact that the Enugu state government, together with ACUs under the National Malaria Elimination Program, it's offering free malaria tests and treatment when you are positive. So yet, that's things that can be done. At least Coast City FM is also taking the lead. You are giving us this opportunity to educate the populace on how to be safe at this risky season. So I want to say kudos to you at the Coast City FM for this platform you have given to educate the citizenry on the issues about malaria and how we can be safe at this rainy period.
There are concerns globally about resistance to some malaria medications. What should people know about taking anti-malarial drugs correctly and responsibly?
Yes, anti-malaria resistance is a serious issue. We are able to bear with the chloroquine resistance because of the rollout of the ACTs. And now we are beginning to hear of ACT partial resistance in some African countries, especially East African countries like Uganda. And so it's a really, really serious concern that when you are giving your prescription that you should take it as a when due and for the duration of time. This thing that people do, you take your malaria tablets for the first day, take it the second day, you have relief and then you abandon it. Those are the things that lead to the parasite adaptations to strengthen itself, because just like you are struggling to survive, the parasites are also adapting to survive, and so they begin to build resistance to the anti-malaria drugs. And this is really dangerous for under 5 children and for pregnant women. You might interest you to know that of the global malaria death, 75% of it occurred in children less than 5 years. So imagine a world where you have severe anti-malaria resistance. What will happen to children under 5? What will happen to pregnant women? What will happen to people that have anemia or that just got discharged from hospital and they have anemia and unfortunately they were infected with malaria parasite while in their hospital? What will happen to them? So it is a clarion call that people should become very responsible when taking their malaria treatment. They need to be very serious.
As we round off, what final practical message would you like our listener to remember about staying malaria-free during this rainy season?
This season, to stay free from malaria, you must do 2 things. Prevent mosquito bites and prevent the infections from taking root. To prevent the mosquito bites, you will practice sleeping under the net, sleeping with long sleeve clothes and trousers that is thick enough. You can use repellent, you can use vaporizers or coils to make sure that you bring down the mosquito bite. You can also put effort in reducing the mosquito population by making sure that there are no stagnant water pools around you. And then there is the practice of what is called preventive chemotherapy, where you meet your physician and he will take you through the seasonal chemopreventive approach, or for a pregnant woman, intermittent chemopreventive approach that it's being practiced to protect people from the malaria infection. So for travelers, there is a practice of chemoprophylaxis. I don't like mentioning specific drugs on air so that we make sure that we are consciously reducing self-medication. So these are certain things that people will do. Then most importantly, take advantage of the services that the state is offering in the primary healthcare centers, which is free malaria testing and treatment when you are positive. It's going on in the over 500 primary healthcare centers by the Ministry of Health, ACUs, under the National Malaria Elimination Program.
Thank you very much, Pharmacist Nonso Maduka of Bensther Development Foundation, Enugu, and member Enugu State's Malaria Advocacy Communication and Social Mobilization Core Group, for sharing those important insights with us today. You've been listening to our discussion on malaria prevention during rainy season. Remember, malaria is preventable and treatable when we take the right steps early. Keep your environment clean, sleep under treated mosquito nets, and seek proper medical attention whenever symptoms appear. Thank you for listening. Stay healthy and stay safe. Producer has been Jude Obu. Supervisor is General Manager, Core City FM, Kate Nebo. The Zonal Supervisor is the Deputy Director Programs, Joy Obitilata. And the Executive Producer is the Zonal Director, Radio Nigeria, Enugu Zonal Station, Dr. Ikechukwu Eze. My name is Ekene Odigwe, and this has been Breakfast Show on Radio Nigeria, Core City 99 FM, Enugu.